Welcome back to Muff, Minutes Until Fit. This is your host, Imani. Our mission here on this channel is to bring awareness, give motivation, encouragement, and inspire our viewers in the best possible way. We aim to bring comfort to your mind, body, and soul. We discuss areas of importance of many ailments that many of you are suffering with or just want more information on. However, the information contained in this video is of general nature and does not constitute medical advice. Talk to your doctor for your individual circumstances. This week, we will cover Autism Spectrum Disorder. There will be several videos on this because it's very lengthy and I don't want you guys to get too bored with it. This week, we will cover signs and symptoms, patterns of behavior, and what autism spectrum disorder is. Don't forget to hit the like button and subscribe to my channel at the end of the video. What is autism spectrum disorder? Autism spectrum disorder is a developmental disability. It's a lifelong disorder that includes differences or challenges in social communication skills, fine and gross motor skills, speech and intellectual ability. There's often nothing about people with autism, the way they look, that sets them apart from other people, except for the fact that they may communicate, interact, behave, and learn in different ways than other people. Autism is neither a mental illness nor a condition that gets worse over time. Autism affects daily functioning, but some people with autism become better able to manage life with their condition with intensive treatment. Autism was first described as a distinct disorder during the 1930s. The definition has changed over the years. There used to be names that were looked at as separate diagnoses. Autism was once called Asperger syndrome, childhood disintegrative disorder, and pervasive developmental disorders not otherwise specified. But now, the Diagnostic and Statistical Manual of Mental Disorders grouped all the names together and is now called Autism Spectrum Disorder, which spectrum refers to a wide range of symptoms, skills, and levels of disability and functioning. Autism does not discriminate, and it occurs in every racial and ethnic group across all socioeconomic levels. The CDC estimates that 1 in 68 children has autism and that boys are more likely to develop autism than girls. Autism begins in early childhood and eventually causes problems functioning in society, socially, in school, at work. Some children show symptoms of autism within the first year. Some children will develop normally during the first year and then go through a period of regression between 18 to 24 months of age when they develop autism symptoms. Each child with autism has a unique pattern of behavior and level of severity, from low functioning to high functioning. Some children with autism have difficulty learning, and some have signs of lower than normal intelligence. Other children with the disorder have normal to high intelligence. They learn quickly but have trouble communicating and applying what they know in everyday life and adjusting it to social situations. Because of the unique mixture of symptoms in each child, severity can sometimes be difficult to determine. It's usually based on the level of impairments and how they impact the ability to function. As some children get older, they become more engaged with others and show fewer disturbances in behavior. Some with least severe problems may lead normal or near normal lives. Others that continue to have a hard time with language or social skills in their teen years can bring worse behavior and emotional problems. Autism can possibly be mild, moderate, or severely autistic. They can also have a combination of mild and severe symptoms. They could be very intelligent and verbal, but also have severe symptoms of anxiety and sensory dysfunction. Severe forms of autism can be hard to manage because they could have aggression behaviors and extreme communication challenges. But high functioning autism is often accompanied by mental health issues like anxiety, obsessive behaviors, sensory dysfunction, and even depression. Autism can range from gifted to severely challenged. Signs and symptoms of autism. Symptoms usually begin before age 3. The child fails to respond to his or her name or appears not to hear you at times. The child resists cuddling and holding and seems to prefer playing alone, retreating in his or her own world. The child has poor eye contact or lacks facial expression. The child doesn't speak or has delayed speech or loses previous ability to say words or sentences. The child can't start a conversation or keep one going, or they only start one to make requests or label items. The child speaks in an abnormal tone or rhythm, makes use of a singing, song voice, or robot-like speech, repeats words or phrases verbatim, doesn't understand simple questions or directions, shows no emotions or feelings and appears unaware of others' feelings, doesn't show interest in objects, approaches a social interaction by being passive, aggressive, or disruptive. They feel overwhelmed. They have a hard time recognizing nonverbal cues, can't interpret others' facial expressions, body postures, or tone of voice. Hyperactivity, impulsive, aggression, short attention span, causing self-injury, temper tantrums, unusual eating or sleeping habits. Patterns of behavior. They will have repetitive movement like rocking, spinning, or hand flapping. The child is not aware of activities that could cause self-harm like biting or head banging. The child functions off specific routines and rituals and becomes disturbed at the slightest change. They have problems with coordination or has odd movement patterns such as clumsiness or walking on toes, has odd, stiff, or exaggerated body language. They are fascinated by details of an object like the spinning wheels of a car, shaking sticks, or flipping levers. Unusually sensitive to light, sound, or touch, yet may be indifferent to pain or temperature. Doesn't engage in make-believe play. Fixates on an object or activity with abnormal intensity or focus. Has a select short list of preferred foods. Ritual behaviors, lining up objects, repeatedly touching objects in the same set order. Does not understand personal space boundaries, and some of them are very organized. Thank you for tuning in once again. This has been your host, Imani. Please feel free to comment or email to suggest any topic that you would like more information on. I will be glad to help out. Don't forget to hit the like and subscribe button at the end of the video. Until next time, be blessed. Peace.